Now, the hospital where Princess Kate was treated has launched an investigation over claims staff attempted to access her private medical records. The London clinic is looking into the major security breach, which is believed to involve at least one staff member trying to access the princess's notes. Health Minister Maria Caulfield said the Met Police have also been asked to look into the matter, although this morning the force said they're not aware of any referral having been made yet. The London clinic, ironically favoured by royals for its discretion, released a statement today saying there is no place at our hospital for those who intentionally breach the trust of any of our patients or colleagues. The PM's now weighed in, with a spokesperson saying, clearly there are strict rules on patient data that must be followed, and we all want to get behind the Princess of Wales. Well, it's yet another difficult moment for Kate, who plans to make a soft return, we're told, to public life after she's finished recuperating. The princess has been dogged for the last few weeks with conspiracies about her whereabouts, even after The Sun published footage of her shopping with her husband, William. Well, the man who took the video, he's called Nelson Silver, came out yesterday to tell trolls, I saw her with my own eyes. And he asked, what more do you need to lay off her? I mean, I agree with him on that. I think it's ridiculous, and yet, you know, even days and days after we saw that video, there are still people who are convinced it wasn't her, and so on. Obviously, today's story is actually much more serious in many ways. You know, a potential security breach at the hospital where not only Kate but Charles also was being treated. On the other hand, are we surprised? I mean, these are two of the most high-profile people, certainly in the country, potentially on the planet. I'm not personally surprised that somebody tried to get into her records. I'm rather relieved that they failed to get into her records.
I am quite surprised, though.
Surprised.
Aren't you?
No, I'm not, because I think, gosh, it must have been unbelievably tempting for particularly low-paid people. I mean, there'd be a whole number of people that would have an interest in trying to find out what was going on with her treatment.
Even just personal curiosity.
Right, just people who were just, frankly, nosy, A, and B, there may well have been one or two very low-paid people who thought that they might make, and rightly they would have, made a vast sum of money by being able to provide some intelligence to some disreputable source.
Saying as people left, can you find out anything?
But I mean,
we'll offer you some money.
the central tenet of having that doctor-patient relationship is trust and confidentiality, and that I mean, it's so intrinsic and it's so hardwired into myself and all my colleagues that I was absolutely shocked. It's absolutely outrageous. Now, when I go back to my days being in hospital, which was about 3,000 years ago, all the notes were paper notes, and they were at the end of the bed, and so it was easy for people to have a look and rifle through some of those notes. Of course, now it's all electronic, and that means that you have to have access, you have to have a login, and you leave a digital footprint wherever you go. So clearly, to access those notes, you'd have to have a level of authorisation. But I think you're right, it would be someone lower down the chain that tried to do that. But I think also the London Clinic is known for treating high-profile people. I've treated high-profile people we would never, ever talk about.
But I don't think there's any suggestion that it was one of the medical team.
No.
I mean, we don't know who it was, but I think that is vanishingly unlikely, much less likely. I mean, I've seen when my mother was in hospital, it's perfectly possible to hover behind a screen and see people's medical notes. I obviously didn't look at anyone's except for my mother's, because those were what were up on the screen. But there could have been plenty of people who were not involved in her care, who were drifting around and might have had a look.
Yeah. You get those boards, don't you, as well, in
you
wards,
do,
where
absolutely.
By the nurse's station, where they have a name.
Yeah, and
I mean, goodness knows what her state.
But she would have gone under a different name, wouldn't
exactly,
she? And she'd be in a private wing and a private room and so on and so on.
But we see it everywhere. We saw it with the police, curious police officers looking at crimes and instances that had nothing to do with them, and they're caught going on the system, trying to find out more details and then sharing it amongst. I don't think it's that surprising that it perhaps happened or hasn't happened. But it's great that the person will be investigated and hopefully they'll be caught. But I don't think this will change. I can't see the royal family seeing this one incident and saying, right, we're going to find a new hospital.
No, I don't. Do you know, frankly, I think it's an absolute miracle that details of her condition have not come out, because there must be quite a number of people who know. And it is wonderful and marvellous that that has somehow been kept under wraps.
But this guy who's saying, isn't this enough? Leave her alone. mate, you sold a video.
Well, yeah.
You made a lot of money
Yeah.
and, by feeding the circus. If you want to lay off, you should have kept that video to yourself.
I mean, it's really interesting. So some of my friends work there, and we had a discussion amongst ourselves. Should we actually get in touch with them? Should we find out? And of course, as I said right at the beginning, it's so hardwired that we wouldn't ever do that.
Yeah.
Oh, well, you're saying you know people who
I know people
work in
who
the
work
London
there
clinic.
and who would know.
Yeah,
Yes.
who would know what was going on. And on that issue, it is interesting that they have maintained that secrecy. I mean, it's what they said they were going to do, and I've always believed that was primarily to protect the children until they were ready to fully, for the children to have to go into their schools and be quizzed about it and everybody to know. I always thought that was probably the most likely reason, because we know they are very protective of the children. But I had a conversation with a few friends in the last few days, and they were saying, well, actually, sometimes keeping secrets from children can make things worse, just on a psychological benefit. And they are quite young. And I was sort of thinking about, but not everybody's father is going to be king one day. That's a different situation.
It didn't honestly occur to me that it was for the children. I think that seems really unlikely. Surely the children know, I mean, the children will know what the condition is because they live with their mother. So
I very much doubt they know the full, because if they are trying to keep that secret, would you really let your 3 kids go to school where they could let something slip and then suddenly that, if you're working so hard to maintain that secret?
That's really interesting. I'm with Isabel. I would have thought that actually they would know.
Well, you would tell a 4-year-old.
Well, I would say
telling them,
Mummy's
it just-
having a tummy operation, an abdominal operation, but I wouldn't obviously go into the details of every single part of it.
yeah.
No, but that's what we know. No, I mean,
Yeah.
obviously
They probably
will
know as much as we know,
yes,
is
that's
the
what I'm
reality
saying.
of
I'm
it
saying
all.
they wouldn't know more than
Because it would be odd as well, because, the suggestion is that William's been around much more to help with, taking the kids to school, and that she's been pictured with her mum, so she may have been more present. So I guess they'll have known there's a difference because they're around more at home. But I'm sure I would doubt they've been told
I
more
wasn't
than
saying
us.
that the children didn't know she'd been in hospital, didn't know she'd had an operation. But what I'm saying is I'm sure that, I suspect they know what we know and probably, not the full details. Is my suspicion. Now, somebody else has joined in all the conspiracies today.
Oh, good.
It never stops. So this is a chum of Harry and Meghan's, a supporter who appeared on their Netflix documentary. He is the tech CEO, Christopher Boozy. He has claimed, he has stated that Kate hasn't been seen in public since Christmas Day, of course. I guess what he's saying is that wasn't her at... If he's still saying, as you can see here in his tweet, that she hasn't been seen since Christmas Day, then presumably he's implying that wasn't her at the farm shop. He also shared a compilation of clips featuring William and Kate in an attempt to prove that the recent footage, wasn't.
So I have been away on holiday, and on holiday I have heard everything. The King's dead, Kate's dead, everyone's dead. And so these conspiracy theories are way out of control.
Oh, they are.
Completely out of control.
Yeah.
And also in many ways, actually, the way that social media has evolved, the palace, I think, has been quite slow to comment. But then equally, we were told right at the beginning she was going to be out of action and she would be back at an appropriate time. And so actually, nothing has changed.
So were you being asked on your holiday
Yes.
about it? Yeah.
Yes, is the king dead? Has he got this? What has he got?
Did
What's
you say,
happened to Kate?
I'll just call Buckingham Palace and find out?
Exactly. Hotline, straight from my holiday.
But Kate and co have brought it on themselves because if they stuck to the plan of she's going to be away till after Easter, fine. But then don't release a picture that's been heavily doctored, because that just adds fuel to the fire. What they should have done is not, like we all know, social media is not a real place. What's said on Twitter by a large amount of people on Twitter is a tiny minority of what the real world is saying. So they should have just not listened to the plebs on Twitter and carried on with the plan.
I think they've also suffered a little bit because they had a plan. Clearly, Kensington Palace had a plan because they said she won't be back until Easter. The problem, I think, was that the King's diagnosis was then announced. And so suddenly it was, but we know he's got cancer, but yet we don't know what happened to Kate. And it's the contrast that I think has caused a lot of the problems.
Yeah.
Because Buckingham Palace went that bit further with his diagnosis, and suddenly the sort of the quietness, the sort of lack of information about her looked much more stark. It looked so different. And I think that's probably where they've ended up with a difficulty they hadn't planned for.
But also the two different teams. I mean, it's clear they're not working well together, but also, they have very little respect for each other. So we're beginning to get to a situation where we all thought that all those, two teams fighting against each other was going to be a thing of the past. And I don't think they're fighting, because I think William and Charles are close. But those two teams, Buckingham Palace have been quite enjoying the complete mess that Kensington Palace have been making of things. And certainly I've, heard them saying, oh, well, they need to they need to sort this out. It's not, they haven't been defending them. Right. They've been kind of slightly thinking, well, we wouldn't have made a mess of it.
Well, look, the single biggest mistake was not having the wedding ring on, or offering any explanation for the wedding ring not being on when you've busily photoshopped the whole of the rest of the picture. I mean, of course, then conspiracy theories are going to be fueled, and quite how that happened, I just have no idea. It beggars belief that well-paid communications people didn't spot that one coming.
Yeah, absolutely.